Walz is about to provide another update on the state's response to the COVID-19 pandemic. The governor is still in isolation, so this update is being delivered over the phone.
Governor Tim Walz.
Thank you, Teddy. Good afternoon, Minnesota, and thank you for joining us again. We send out our condolences, and one more of our neighbors has become a fatality of COVID-19. Commissioner Malcolm will go into a few more details. A good news story is that, as many of you may recall, 2 weeks ago, one of the state troopers who's on my detail tested positive and came down with COVID-19. He has since recovered and is fully back. So there's a good news story there. Before I talk about a few of the things that are happening and get an update, I just want to just reassure people, and I want to let Minnesotans know that the job that our journalists are doing on here has been nothing short of spectacular. The questions that they're asking are exactly the ones that need to be answered. And I think whether it's the names of congregate care facilities or trying to dig down deeper into some of the details is exactly what they should be asking. We are trying to balance personal privacy and civil liberties against public health in this time, always with an understanding, though, in a time of crisis, and especially one unprecedented like this, misinformation or the lack of information is stressful and potentially dangerous. So starting tomorrow, I think I will walk through with folks a web portal, some dashboards that are able to, I think, provide more in context while still protecting individuals' personal privacies, but to make sure that as we're asking each and every one of you out there to sacrifice by staying home, by sacrifice economically, socially, to be able to track the progress that we're making around those ICU facilities, around the PPE we're getting, and how we're starting to think about the work groups and those chains of command that as we move forward towards peak, how are we going to make sure that we're inputting data and being nimble? And I'd like to do that. So I want to make sure that to acknowledge that fact, to make sure today that we will do our very best, as always, to provide as much as we can, but to know that these questions need to keep being asked, because as Minnesotans see this, I think there can be a sense of comfort in the work that's being done. At the same time, know that we are very serious about people's personal privacies and civil liberties. With that being said, I just wanted to reiterate a really great piece that came out of the COVID-19 supplemental budget. Yesterday, we announced that the application process for emergency grants was open. Those are being used now. Child care providers can apply. They're the ones that are providing child care for our essential emergency Tier 1 and Tier 2 responders. The grants are going to be critical for keeping that in the community, keeping folks working. Grants have about $10 million a month for each of about the next 3 months to keep the child care capacity up where we need it to. So I want to say thank you for that. And another issue, and you're going to hear from a new speaker today, Commerce Commissioner Steve Kelly and his team have been working with the Minnesota Health Insurance Plans. Several requests that we had around removing barriers to people receiving their coverage around COVID-19, and we wanted to make sure that coverage for testing, telemedicine, preventative care, and then should someone need treatment for COVID-19, to make sure that did not create an incredible burden on them. So Commissioner Kelly, working closely with them, was able to come to a conclusion, and today I'm happy to announce that the Minnesota Health Plans will be waiving cost sharing for treatment for COVID-19. What that means to Minnesotans on these commercial plans is it means that you're not going to have a bill when you go into, and should you happen to have to get care, they're going to waive that cost sharing. So you're not going to have to choose between rent and food around this. So I'm grateful to the health plans for working with us. I think it shows a real sense of spirit towards Minnesota, and I'm certainly grateful for the incredible work on many different fronts that Commissioner Steve Kelly and the Commerce Department is doing at this time. And so with that, I'd like to turn it over to Commissioner Kelly.
Commissioner Kelly, just want to make sure that you're not on mute right now.
Teddy, if he's not quite ready, I think we could jump on to Commissioner Malcolm to update on where we're at, and we can come back around.
Yep, that sounds good. Commissioner Malcolm.
Sure, happy to do that. Thank you, Governor. Good afternoon, everyone. We'll give you today's MDH update. Globally, as of this morning, we were fast approaching 1 million cases around the world and fast approaching 50,000 deaths, specifically 951,900 global cases, 48,200 deaths. In the United States, we're now reporting 216,722 confirmed cases, over 100,000 of those in the New York and New Jersey region alone. In the U.S., we are reporting 5,137 deaths, 1,374 in New York City alone. In Minnesota, we now have 742 laboratory confirmed cases in Minnesota. It's an increase of 53 from yesterday. And as the governor mentioned,
9566. I was on a landline and I couldn't be heard in the conference.
I think we have Commissioner Kelly in the background.
Yes.
I'll just keep going.
Steve.
As the governor mentioned, we confirmed one additional death among our Minnesotans for now a total of 18. That was a 69-year-old Hennepin County resident, not associated with a long-term care facility. As of today, we have 373 patients who have recovered from COVID-19 and have been released from their isolation period. Since the start of the outbreak, 138 COVID-19 patients in Minnesota have been hospitalized. Today's total is 75 patients currently in the hospital. That is an increase of 21 from yesterday. 38 of those are in intensive care. That's an increase of 11 intensive care patients since yesterday. 37 in non-ICU bed. That's an increase of 10. So I just want to repeat a couple of key messages for the day. I just want to repeat and stress again how important it is that we be focused on working with our long-term care facilities to protect vulnerable residents in those facilities from outbreaks. I want to say that there's been considerable discussion about, just in the last few days especially, about whether and how to share information about those specific facilities where we have had cases. And as the governor just mentioned, I think the media's questions about that have been entirely fair. We have been, since the beginning, recommending to facilities that have cases that they immediately inform residents, families, and employees. The health department has historically been quite cautious about sharing any sort of disease investigation information that could be used to identify individual patients or compromise patient privacy. This is just such an important value that we continue to hold dear in public health, because people working with our disease investigators are sharing sensitive personal information about their condition, and they need to have a measure of confidence that we will not use the information in any way that will expose them to unwanted attention or potential stigmatization. And that's also a stance that that is allowed within the discretion granted to the Commissioner of Health under state data practices laws to protect that information. That said, with the current level of concern and the risk associated with the COVID-19 pandemic, we believe it's important to balance that value with the equally legitimate value of government transparency and of sharing information with the public to help them understand the course of the outbreak and any protective actions that may be warranted. So to that end, we've decided to update our approach and to share more information about the outbreaks in long-term care facilities. We're still nailing down some of the operational details on this in terms of our notification process and timing, but we will be moving quickly in the next day or two to begin to make that added detail, including facility names of facilities above a certain size, public. I'd also like to reiterate a message that I mentioned yesterday about expansion of testing criteria. Our goal remains to expand that testing, but we know it still remains the case that we aren't able yet to test everyone that we would like to be able to test. While the state health, public health lab has some capacity constraints, we've mentioned that we're grateful for increasing private lab capacity, such as that offered by the Mayo Clinic. that adds to our statewide capacity. So as I mentioned yesterday, we really want our healthcare partners to continue to send samples for congregate care settings, that being long-term care, prisons, homeless shelters, to the state public health lab, and prioritizing these groups because we can manage a 24-hour turnaround time for those settings. We do encourage our healthcare providers to be testing their own hospitalized patients, to be making sure that samples are taken on everyone hospitalized, but also to test people in congregate care settings, healthcare workers, first responders, child care workers, and others that they think they need to test. So we continue to hear that some providers might be defining this more narrowly than had been intended, and that they may be restricting the definition of congregate living settings to nursing home residents only. So we want to just make sure that our healthcare partners know that we believe it's important to include other congregate living settings, such as homeless shelters and domestic violence shelters, in that definition, so that people in those settings get prioritized for testing, similar to the way we're prioritizing long-term care residents. And we want to make sure that workers in any of these congregate settings, with that inclusive definition, are getting prioritized, even if they would not otherwise be considered high priority due to their age or underlying health conditions. Finally, I want to just take a moment to publicly thank our disease investigators who have been working at an incredible pace for weeks and months now. In fact, well before we had our first COVID cases confirmed in Minnesota. Just want to share a little bit of data with you. Our staff at the Minnesota Department of Health has interviewed almost 700 healthcare workers that have been exposed to cases. If we include healthcare workers that facilities assess and report back to MDH, there have been over 1,000. Each one of those interviews represents a significant amount of work. They have contacted 1,631 people who are close contacts of confirmed cases who are at high or medium risk. These would be mostly household contacts and close workplace contacts, et cetera. Each one of these contacts get a personal call from our staff at MDH. This level of engagement in interaction is very, very work intensive. It's people intensive, but it's also very important to help us understand the risks and to help slow the spread within our state. So I just wanted to commend them for their excellence, their professionalism, and to thank them for their incredibly hard work. And with that, I believe I will pass it back to Commissioner Steve Kelley of the Department of Commerce, if he's on now.
Thank you, Commissioner. And thank you, Governor Walz, for the opportunity to talk about the announcement by Minnesota's health plan today. Over the past month, the Commerce and Health Departments have been working with Minnesota's health plans to be sure health coverage protects Minnesotans during this pandemic. In our March 13th letter to the health insurers, Health Commissioner Malcolm and I jointly outlined several areas where health plans could support the state's response to the COVID-19 crisis. We recognized in that letter that some of the plans were already taking some of the steps we requested. Since we sent the letter, Minnesota's health plans have taken additional actions in response to our request and the needs of Minnesotans. Today, the health plans are announcing that they are agreeing to take one of the most significant steps, eliminating cost sharing for COVID-19 hospitalizations at least through May 31st. The reason that this is important to Minnesotans is our goal that if you get sick with COVID-19, your focus should only be on getting better and recovering. You shouldn't have to worry about getting a bill that could ruin you financially, especially during this difficult time. So what does that mean for Minnesotans? Minnesotans in the fully insured and Medicare markets will have no cost sharing for COVID-19 testing. And then beyond that, Minnesotans in the fully insured market who are hospitalized will have no cost sharing for their in-network hospitalization. The plans are also encouraging Minnesotans to take advantage of expanded access to telemedicine services. This will help people stay home and obtain access to care if they need it. Thanks very much for this opportunity.
Thank you, Commissioner Kelley. And now we'll go to Homeland Security and Emergency Management Director Joe Kelley.
Thank you, and good afternoon, everyone. Among the important work we're doing in the State Emergency Operations Center today is finalizing a letter from Governor Walz to the President requesting a major disaster declaration. To this point, we've been operating under a federal emergency declaration, which is different than a disaster. Without going into FEMA bureaucracy, under the emergency declaration, we're already eligible to get many of the costs of the coronavirus outbreak reimbursed by the federal government. And that's for stuff like running operations centers, activating the National Guard, as well as buying and delivering personal protective equipment, medical supplies, and any other measures or many other measures to protect public health and safety. But there's another important program we need a federal disaster declaration for, and it's known as Crisis Counseling Assistance. It provides funding to bolster existing community-based counseling services. Clearly, this incident is causing a great deal of stress and anxiety among Minnesotans. People fear for their health. They're worried about their job and how they're going to make ends meet. Relationships can get stressed by spending so much time together, and just the simple disruption to our regular routine is hard for us all. We need to meet that increased demand for counseling services, and the FEMA program authorized by a major disaster declaration does just that by providing 100% federal reimbursement for the additional services people really need now. I'll be sending the disaster declaration request paperwork up to the governor's office this afternoon, and I expect we'll hear back from the federal government very soon. Now to Commissioner Steve Grove with the Department of Employment and Economic Development. Commissioner.
Thank you, Director Kelly. Hello, everybody. We are here to give some updates first and foremost on the state's unemployment insurance program, which is seeing a record amount of attention and applications. We are up to 297,397 applications since March 16th. And yesterday we saw 24,640 UI applications come in just yesterday. You probably saw the jobs numbers nationwide. 6.6 million Americans have filed for unemployment benefits last week. We know that in Minnesota, we moved people pretty quickly into this system. The governor's executive order was one of the first in the nation that opened up unemployment insurance to those affected by COVID-19. And because of that, this week we're actually seeing less claims than we saw last week. We're one of only 4 states in the nation that has seen those claims numbers trend downward this week compared to last week. And we believe this is because we had that system open earlier and were able to process a lot of applications right away when the crisis hit. That said, we know that there's a lot of people who are experiencing frustration and challenges with trying to get unemployment insurance because it's a brand new system and program for over 85% of the people that are applying. This is a new program people are learning about on the fly as they move forward. And so we are doing a lot to help all of the applicants navigate their way through our system. And I wanted to just share for the public a little bit of what our team has been doing over the past few weeks to give you a sense for how we're responding and just to let you know we're working really hard for you around the clock. We have had thousands of hours of overtime by our staff. We have 50 additional staff taking phone calls. We've expanded the number of hours per week that we are usually open from 60 to 84. We've made a lot of new tweaks to our system to change the benefit request schedule and moderate that influx of applications, and to double the number of servers that we use to run the system so that it can run more effectively and more efficiently. We're increasing capacity for our phone lines, and we've posted a lot of great informational resources online at uimn.org. So we're going to continue to do more to make the system more robust and serve the needs of Minnesotans, and we really appreciate the feedback that we're getting from people. And we know that for so many, this is a challenging thing to go through and a challenging process to walk through. And so our Phone a Friend guideline online is also useful, we hope, for people to help their friends and family navigate applying for unemployment insurance and getting those benefits as fast as possible. I can tell you that of all the weekly payment requests that have come in, we've already cleared 90% of them that are now set up for payment since March 16th. So we are moving quickly to process those payments at a very, very quick rate, and are trying to get quicker every single day. Just to give you a sense for the kinds of applications we are seeing come in, once a week we like to give an update on just the industry breakdown. At this point, we see 66,355 applications in food preparation and serving, 27,871 in healthcare, including practitioners and support, 27,557 in sales and service, 21,881 in administration and support, and 17,166 in personal care and service. So those are the top 5 occupations that we're seeing applications come in through for unemployment insurance. We also know that many industries are hiring. This week, we saw more job openings on our Minnesota job bank than we saw last week. We're up to 3,821 new job postings in the state. Top 10 occupations, which again, we're going to review weekly for folks. Number 1 is nursing assistants, 2 customer service representatives, 3 registered nurses, 4 medical and health service managers, 5 combined food prep and serving workers, including fast food. Much of this is for delivery. First line supervisors of office administrative support workers, social and human services assistants, personal care aides, computer system analysis, and software developers. So there are a lot of folks hiring, and we encourage everyone to go to mn.gov/deed to see more of those postings and the availability of jobs that are there for Minnesotans during this time. Last, just wanted to call out another set of businesses that's been doing great work up in Duluth. We've seen a number of restaurants and cocktail lounges come together, including Duluth Grill, OMC Smokehouse, Corktown Deli and Brews, and Noble Pour. All of them are closed down, of course, because of the pandemic, but they have come together to create a whole food bank and food service for the Lincoln Park neighborhood up there in Duluth to give gift cards and donations to the folks in that neighborhood to help them buy food during a difficult time. Just another great example of businesses coming together across our state to help each other and help their communities in time of need. With that, I'll turn it over to the Department of Education and Deputy Commissioner Heather Mueller. Heather.
Thank you, Commissioner Rose. Hello, everyone, and good afternoon. Every day you hear me share the message that the entire team at MDE, Commissioner Ricker and I, are really thankful for the work that our educators and our school staff are doing on behalf of our students and the work that they put into the creation of their distance learning plans. And today I just want to take a couple of minutes to really paint a picture for people about what that actually means. So in the 8 days leading up to distance learning, our districts and charter schools created over 500 individual equitable distance learning plans that work for their school communities, while also planning for students who are receiving special education services, our English learners, our students who are experiencing housing instability, and those who are in foster care, just to name a few. So some questions we continue to ask are, what is distance learning? And a lot of perception is that distance learning is online learning. And that is not the case. Distance learning does not mean online learning. Educators don't simply upload their lessons onto an online learning platform and call it good. In some parts of our state and for some grade levels, online learning is not a good fit. There are many school districts and charter schools who are taking a more paper-pencil approach or a hybrid of paper-pencil and online learning. But regardless of the approach, districts and charter schools built a plan that was based on their school communities. Now, in addition to creating a model to deliver their lessons that strive to meet the needs of every student in their district, schools across the state also had to come up with their own system to help students receive services like nutrition and meals and school-age care. Now, when we think about meals for our students was one of the first components of their distance learning plan that was created. We know that for many families in our state, the meals that their students receive at school are the only ones that they're able to rely on. So once the Minnesota Department of Education was able to obtain the necessary waivers from the federal government, schools got right to work once again creating their individual methods to continue to deliver meals to families in need. And the turnaround for creating that plan was 2 days. And since that time, the Minnesota schools have served over 1.6 million meals to students since the buildings were closed to students on March 18th. Now, also as public servants, our educators know that it takes all of us to fight COVID-19 together, and that's why when the governor's executive order asked them to provide school-age care to our critical workers for free, they didn't blink and they sprang into action. Again, in just 2 days, over 500 school districts and charter schools came up with their own plan on how they were going to provide that care and how they were going to do so in a safe way that follows MDH guidelines. So I say it every day, and I say it here again today, that our educators are the heroes that are maintaining continuity for our students and families. What they were able to create in this short amount of time is nothing short of remarkable. You know, the right thing to do is not always the easy thing to do. And I would just like to, again, take this opportunity to thank our educators for doing what's right and not what's easy. And with that, I'd like to pass it back to the governor.
Thank you, commissioners. We're grateful for that. We spent some time this morning on conference call with about 120 of our faith leaders, talking about making sure we're administering to people's social, emotional, and spiritual needs, and trying to figure out how the best way to do that. And then my team spent quite a bit of time working and in consultation with the legislature as they prepare to come back or to find some type of way to do legislative business on April 14th. We want to make sure as new issues have arisen that we're ready to address them. We know, and this team knows, we need to be nimble. We need to acknowledge when it's time to change course. We need to move smartly, and we need to move quickly, because this pandemic will not wait for us, nor does it care about our timelines. We simply need to keep as new data on the ground, as new experiences I'm on with other governors throughout the day, we're putting those in. So I want to thank our private sector partners, all of you who are getting calls at all hours of the night, thank you, and to the nonprofits who are providing that safety net. With that, let's open it up to questions.
Operator, we're ready for questions.
Ladies and gentlemen.
That was an update from Minnesota Governor Tim Walz and other state leaders about their response to the COVID-19 pandemic, including the announcement that Minnesota health plans are waiving cost-sharing expenses related to people diagnosed with COVID-19. Wisconsin Governor Tony Evers did not give an update today, but he does have one planned for 1:30 tomorrow afternoon. We plan to carry that live. We'll continue to track developments throughout this afternoon and bring you the latest on the WDIO website and mobile app. And as always, make sure to tune in to WDIO News at 5. Thank you for joining us.
This has been a WDIO News